most famous physical therapist on the internet.
Hi folks, I'm Bob Schroep, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to discuss ultrasound therapy for pain relief. This is actually a home unit. Is it worth buying? You must know this. This is the information you're going to need if you're thinking about going down that road.
Right, exactly.
It's funny with a lot of stuff now, Brad, stuff that before like a TENS unit always had to be done by a professional, and now you can buy your own online.
Right. So
if you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, you're going to want to go to our social media channels and our website, bobandbrad.com, because go to the giveaway section. We are giving away a Sleepovation mattress.
Yeah, these are high-end mattresses.
These are beautiful mattresses for pain relief. We're also giving away a pillow, I believe. We usually give one of their Sleepovation pillows away.
Well, you got to sleep with a pillow.
That's right. You can also find it on Facebook, Bob and Brad. It'll be pinned at the top of the page. Short version of us. Go to Instagram, Twitter, or TikTok.
Yeah.
Take it away, Brad.
Those short versions are shorter than our intro.
Yeah, 60 seconds of Bob and Brad.
All right. Ultrasound therapy. A lot of people are familiar with it. This is not the ultrasound that you use for diagnostic.
Right.
There's ultrasound where, if a woman's pregnant.
To determine the sex of the baby.
Yeah.
And that's diagnostic ultrasound.
Right. They use it to find blood clots. This is therapeutic ultrasound. Designed primarily for a source of deep heat, increasing circulation, which is very true. They know that happens. And chiropractors, therapists for decades have
I've been using it my entire career, so 30-some years.
Right.
I don't use it as much now, but I still use it.
Right. So if you are looking at it and you've seen some wonderful studies or wonderful comments
or articles,
the marketing is like, get this for pain relief, blah, blah, blah. We're going to give you our
opinion.
Right. And if you're going to buy one, there's some things you really need to know to make sure you buy the right one. So we're going to get to this in just a minute. So again, the significant gains, you can go 4 to 5 centimeters is what the study shows.
It penetrates that deep.
Right. That deep. That's good.
Yes, it is.
There's nothing wrong with that. That's very good. But again, they've done studies with people with physical therapy without ultrasound and ones with ultrasounds.
Right.
And the results are not significant that if you use ultrasound is going to make a significant difference.
Yeah, it's just the studies aren't holding up to be really supportive.
Right.
They're not negative,
right.
But they're not real supportive either.
So like I use it occasionally. There's certain instances depending on what I'm trying to achieve with a specific patient, but it's not very often.
And I tend to use it more as what we call phonophoresis, where I'm using the ultrasound waves to push medicine in. And that's not something you could do yourself at home because the medicine is a medicine you have to get is a prescription.
Right.
And I'm not sure I'm sure the layperson maybe could get it, but it'd be a lot more difficult.
The FBI might be coming.
Yeah, that's right. Somebody would be knocking on your door.
You need a doctor's prescription and whatnot. Yeah. Sometimes the only time I will use it if I want to get deep heat and I want to like increase range of motion.
Sure.
I mean, I would consider it with a frozen shoulder.
I would too. Absolutely.
It wouldn't be my first go-to, but I might consider it. So if you decided you're gonna
give it a go,
get an ultrasound. I've looked them up on the internet to find out, geez, are there any good ones you can just buy, and are they going to be strong enough? And is it adequate? So here's what you need to. Well, first of all, if you do have one of the following instances, like if you have skin that's not healthy,
right? These are contraindications, basically, or warnings of where you want to use this. So don't go buy a unit when you have one of these things.
Right. If you had an elbow, you think you're going to use ultrasound on it, but the skin, you may have, if you have a rash there or you have an injury or particularly
an open area,
you're not going to use it. Cancer.
Yeah,
if you have,
any cancer pain, you can't use it for that.
If someone says they have cancer or a history of cancer, I don't even consider it.
Right.
Pregnant, obviously you're not going to use it, around the fetus area at all. Not by your eyes and not over bones. If you go over your bone versus muscle because you want to ultrasound that joint,
yeah,
it's going to hurt.
What it starts to do, it starts to heat up the outer edge of the the bone,
Yeah.
the outer layer of the bone. And I felt that periosteal pain.
Sure.
I mean, I haven't felt it recently. You felt it not too long ago, you said.
No, I did it to myself because
Oh.
when I was a student, it's like, well, you can't go over bone, but they always say you're not going to hurt yourself with
Right.
ultrasound. So I thought I'm going to do it, and sure enough, I went over my bone, and sure enough, it was painful.
Yeah.
So I stopped, and everything was
I've
fine.
had patients that have mentioned it to me, and then we back off right away.
There's no benefit from trying to
No.
fight through that pain.
No, not at all.
And now that my biggest concern is if you're going to buy an ultrasound unit, you have to get the right specs. So
Sure.
I've got a board here to help show that, and so you can pause this if you want to. But
Mike, can you see this okay?
yeah, is that clear enough?
All right.
First of all, if you're looking, the cost seems to be around a couple $100. You can get some cheaper ones. You can get them a little more expensive, but somewhere in that range. But look at the specs. The frequency, this is megahertz. Now, oftentimes they're rated at 1 megahertz or 3 megahertz.
Okay.
3 megahertz will not go as deep into the muscle. 1 megahertz can go up to 4 to 5 centimeters. If you're doing 3 megahertz, you might get 1 centimeter.
Oh, really?
Yeah.
Okay.
So if you're getting one, make sure it's rated 1 megahertz. If you
Okay,
want deep
gotcha.
heat, the wattage. Now this is a little confusing. I always go 1 to 2 watts is what I've used clinically, but that's watts per centimeter squared.
Right.
It has to do, if you look at this is one of our ultrasounds, this is an older one,
Old unit, yeah.
but the surface area of the head relates to the wattage.
The square units.
Right,
Of
the square centimeters.
Sure.
Now I looked up one online, it put out 6 watts. Now don't get that confused with watts per centimeter squared because I read further and the head was a 4 centimeter square surface area. So you have to do some math. So this unit doesn't put out 6 watts per
4
centimeter.
divided into 6.
Yeah, it actually puts out 1.5
1.5
watts, which isn't too bad. Actually, that's enough.
That would do it. That would do it.
That would probably
Yeah.
do it. So if you make sure you get the right frequency, the right wattage, and then the treatment time, we go 7 to 8 minutes.
Yeah.
And that's enough. The thing about ultrasound, if you want to do a big area, if you think you're going to do your whole quadricep, you're not.
Right.
You can do an area.
It's good for confined areas.
Right. You
Yeah.
know, the area of maybe a silver
Orange
dollar.
or
Orange. Yeah.
Yeah.
Right.
Apple.
Right. And the other big thing is look at this. This is really critical.
yeah.
It has to be pain-free. If you're experiencing pain or it's getting warm, it's like it's getting hot, that's not acceptable. You cannot be that warm.
Yeah, you've got to kind of know what you're doing with these. I mean,
Yep.
you got to follow the instructions. With our head, you have to keep it moving.
Yep.
And
You're
yeah,
not supposed to take the head
Head
away
off
from the body.
right.
It's hard on the crystals and
Yeah.
the head. There's a lot more to this, and we do have a video on how to use an ultrasound unit. You can Google Bob and Brad ultrasound and look at that for more details. So,
yeah.
ultrasound, can you buy one? Yes. Should you?
Yeah.
We're thinking probably there's better ways to treat
that's
yourself.
right.
But if you want to, go ahead, use these specs. Look at our video on how to use it in detail because you do need gel.
Yeah. Gel.
Innate gel that's not going to have medication in it.
Yeah.
Don't use it with icy hot and that kind of
Right.
stuff.
Right. So,
So-
a lot of things to keep in mind. So,
Right. So good luck and enjoy.
thanks.